Well, welcome back, guys. Flu vaccines are especially important this year due to several factors, including the possibility of being co-infected with both the flu and COVID-19. Now, joining us in the studio are our friends from Healthcare Express. We've got Dr. Tim Reynolds, his son, Dr. Spencer Reynolds, and Kim Moore, Director of Nursing at Healthcare Express, to tell us more about the flu shot and why it's so important to get it. We also have Josh, who's going to be getting the shot in just a little bit. You okay?
I'm okay. Are you okay? You're going to have to watch this.
I'm a little nervous. Dr. Reynolds, thank you so much for being with us today.
I'm a little nervous for him, too.
Are you a little nervous? I think we all are. Needles make everyone a little queasy. So tell us why it's so important this year to get that flu shot.
It's important every year. It decreases hospitalizations up to 44%. We don't want to overwhelm the hospitals, but especially this year when we also have COVID. We're going to have two viruses that cause a lot of the same symptoms, and so if you're immune to one by getting the vaccine, at least that'll help us to make the diagnosis and know what's going on with it.
Absolutely, and I know some people are saying that wearing the mask is very important, and the flu shot could certainly help, and it could be like wearing the mask. It protects you and it protects others.
It does, and it doesn't make it so that you shouldn't wear the mask, obviously, but wearing a mask does not mean you shouldn't get the vaccine.
Yes.
You need to do both, get the vaccine for the flu and then wear the mask to help prevent the COVID. We don't have a vaccine, as you know, yet for COVID, so the mask is still important for that.
Absolutely, and that was kind of my next question for you. Is the flu shot is not going to protect you against COVID-19, but there could be some complications if you were to have both at the same time, and that is a possibility.
Absolutely. So you want to be protected against one, so at least if you get the other one, the worst thing would be to have both at the same time. And we haven't had a lot of that yet. That's our fear. I mean, our big fear is that people have flu and they have COVID at the same time, and we overwhelm the healthcare system, we overwhelm the hospitals. We know we can prevent the flu, so let's do that, and then it'll help the whole system.
Certainly, and I know there are some misconceptions when it comes to the flu.
And I was to say, it's my understanding you are already seeing flu cases this year.
Yep, we've already started seeing flu. We started last month. We're seeing a few cases now. It's just going to get worse as time goes on. You know, the big number tends to be December, January, February, and so now's the perfect time to get your flu vaccine.
Absolutely. So are you ready?
Yeah, I'm ready.
Let's do this.
Are you ready?
We're going to let Josh get this shot here. And while he does so, Dr. Reynolds, are there some misconceptions some people that some people might have